I'm on the air. Well, good morning, everybody out there. This is Victor Kuhns with Vet Talk this morning. I'm at the Portland VA Hospital, a little rainy and cloudy, a little chilly, and we had a little bit of a wind coming through this morning. We're going to be talking today about some issues, and we're going to be talking about programs for veterans returning from Afghanistan and Iraq. But a couple of things that I want to do real quickly at the very beginning here is I want to thank the sponsors of Vet Talk for keeping us on the air. I also want to remind everybody very quickly that next month is going to be Vets Crossing Month, and we're going to be working with a program on the air talking about the entertainment that's coming up through Vets Crossing and helping out. And Rocky Lynn will be there entertaining. So we got a lot of good programs coming up in the next 2 to 3 months. But today, very important, is our young men and women coming home and what we're going to be doing for them. And today I have Vicki Kohler with me, and she's going to start in. I'm going to just give her the mic, and she's going to tell us a little bit about the program she's created to help our veterans.
Thanks, Victor. Well, thanks so much for having me today. And again, Victoria Kohler here, and I manage the Returning Combat Veterans Program for Iraq and Afghanistan here at the Medical Center, which also covers our clinic locations across our service area. I started the program in 2007. It was rolled out from VA Central Office in Washington, D.C., to kind of stand up these programs, and they're case management programs. So that means that there's social workers and nurses who work directly with the veterans. We start working with them sometimes prior to discharge from active duty. We have a relationship with military treatment facilities, so folks who are being treated active duty and we know are coming back to our area, we actually contact them prior to leaving and get them appointments for VA care set up before they leave. So that's a big piece of our program is providing the care and help during that transition from active duty to veteran status. The other piece that we do is provide support in our post-deployment health clinics. And our post-deployment health clinics are in 7 different locations all across our different CBOCs, which we call community-based outpatient clinics, as well as up here in our Portland Center for Women's Health. These post-deployment health clinics are special clinics for returning combat veterans with a group of provider really kind of wrapping around services around the unique needs of combat veterans. We understand that when you go to war, you bring back war with you. War changes you for the good and the bad, and we want to embrace that and support that along the way. So that's another piece of what we do is supporting these clinics. Another large piece of what we do is outreach. So we work with our community partners, like we were talking about the summit that we all went to down in Salem, understanding who else is working with these combat veterans in the community, how can we partner with them to link them to resources. Transitioning from the military to veteran status can be a tough time. There's a whole new rule book and understanding what you need to do in order to get your VA benefits, in order to get access to VA health care, in order to support your family, get back on your feet, and in order to, just start a new life. So that's what we're here to do.
Well, Victoria, and part of that, and as you said, we were at the J9 Summit down in Salem 2 weeks ago, and we heard an exceptional speaker, a young lady that come back from Afghanistan. And even with all of our programs and all the support we have out here right now, people are falling through the cracks, as she did. And the only relief she found was to join and go back. How do we get to these people before they end up putting themselves through that trauma a second and third time?
Right, and so that's why we're moving our services as much as possible before they even release from active duty. So we've set up a unique program here where we actually go to the demob sites. So we gone to Fort Lewis several times, and we meet the planes when they're landing coming back from Iraq or coming back from Afghanistan. So we're seeing these service members while they're a captive audience right when they get back. We attend their mandatory briefings. We attend the informal briefings we work with them one-on-one to complete their benefits, so we know who they are, and we can outreach to them when they get back. In December, we went out to Fort Dix, where a group, an Oregon unit, came back from Afghanistan. And again, we were there with the Oregon National Guard, with the J9, meeting them at that point in time, accessing them to benefits. So we don't wait till they get home, till they get back into the communities for them to maneuver through the system. We've moved that up even sooner.
And the programs we have are not just for the veteran itself, but they're for the families also. And how can the families find out more information about this, knowing that their sons or their daughters are coming home, or husbands, and grandchildren are even coming home, and they have concerns?
Right.
How can they get a hold of you folks and start getting the process going for the returning veteran?
Yeah, there's several different ways. I think you're looking at a flyer for our family support group. We have a family support group that we offer here through our office, that we offer to families of veterans who served in Iraq and Afghanistan. That's one option. We just attended a outreach event this past weekend, and it's called While You Are Gone. And it was for the current unit who's deployed to Afghanistan and their families. So their families came in. It was at the Oregon Gardens, and this was sponsored by the J9, and we were there with them to support the families. So they brought in the families to the Oregon Gardens, the families who are currently deployed, and we were there talking about, how are things going? We're anticipating their return. What is it going to be like when you return? What kind of services and resources do you have? Know them now, before a crisis hits or before the difficulties hit down the road, so you know when something does happen where you can turn to quickly for help. So we do that through our family group. We do that through our work at the outreach events. And then we do that day to day in our clinics. We encourage veterans to bring their families in with them, because they are the ones that are in the homes, that are meeting with them day to day. They can tell a really nice story about what's going on, what's truly, when you come to a doctor's meeting, you have that opportunity to share with them, but that's only a one unique picture. But when the family's present, you get really the whole story. One more piece to add about families is we started a caregiver support program, and you may or may not have heard about this. Hopefully you have, but it rolled out last year nationally. We have a caregiver support helpline nationally, and if anyone calls that caregiver helpline, they're linked to a local person in my program who will work with them on that. And it's again for all ERA caregivers, and then there's a certain link for certainly the severely injured veterans of Iraq and Afghanistan.
Now, so people get a better understanding of the caregiver program.
Yeah.
What does it consist of?
There's, like I said, there's a helpline. We link them up to services available for family and caregivers here. So we have family counseling, we have our family groups, we have education groups. We had a really nice, it was Caregiver Month in November, so we had a really nice caregiver event up here where we had a caregiver tea. And it was an opportunity for caregivers to get together and talk and know one another and support one another. And again, we have a local caregiver support coordinator here who lives in my program who provides that support.
Well, amongst, a lot of times it is the wife or the mother and father that ends up being the caregiver.
Yeah.
Through this program, is there assistance that they can come through you and get somebody to assist in the caregiving so that they can get away?
Yeah, we link to all available resources, VA and in the community, to kind of support those. And again, the caregiver support program is one piece of this overall kind of OEF case management that we're trying to do. So there's 10 different people who work in my program. Caregiver support program is one of those.
Well, we're going to take that, and we're going to take a break here just for a moment, and we're going to be listening and talking about our sponsors. So, Jim, it's back to you. Radio Ray, how are you this morning? Jim must be out ill again today. Well, that's good. So anyway, we're going to get back here and we're going to talk a little more about the programs for our returning soldiers. And it's been really enlightening in the programs that they have up here. And one of the things that I'm going to get into here now is our soldiers that are coming home and have come home through the program that has been developed here. What are some of the expectations that we can expect and you want to do?
So so as I talked about earlier, we recognize that the transition time can be difficult. And I think we've heard other people in the community talk about what reintegration is like. It's not you come home, you change your clothes, and you're back to your new job. It can be a process. It can be, some people, the most recent Oregon legislator said it would be a 3-year process. Other people say, once a warrior, always a warrior. So we want to understand that piece and work with that service member and that family member where they're at. I think you're referring to our pamphlet here, and this is something that we have available in our office, and it discusses the program, the medical center, and it has a really nice picture of our 10 different case managers who are working with the program. And it talks about expectations and tips for when you come back. Some of the expectations, some things, they may miss the excitement while they're deployed. Spouses and family members may have learned different skills to cope while that service member was deployed. You may not want to talk about your experiences when you come back, even though people still ask you. And this is not new stuff. I mean, this is stuff, we've had combat veterans for years, and so we know this. But it's new for us to be talking about it and educating it, being out in the open. So that's what we're trying to do here. We, on the break, we were talking a little bit about utilization rate. And I'm speaking about this cohort of veterans, this Iraq and Afghan cohort of veterans, and I'm speaking about the health care. So VA is broken up into several different components. You have VA benefits, you have VA health care, and then you have VA cemeteries. There's 3 different distinct components. So I'm talking about VA health care. And as far as utilization rate in this group, it's actually highest among any cohort of veterans. And I think it speaks to we're actually doing a good thing, and we're doing things differently. So 65% of the people who are eligible for this health care in our service area are using it. In our region, so that's Oregon, Washington, Idaho, and Alaska, 60% of the people who are eligible for VA health care are using it. Nationally, so all centers, 53% of the people who are eligible for this health care are using it. So this is our newest Iraq and Afghan group. I can't say that enough. So we're doing things different. I think we're doing it better. Is our job done yet? No way. These troops are still coming home, and we still have opportunities for improvement.
As programs that you've run across in the communities, how can your program fit in with the programs out there, and what can the people in the communities do to bring your program a little more alert to the people?
I appreciate that. We work really closely with the J9. We work really closely with veteran service officers in the community. We work really closely with Veteran Benefits Administration, but I'm sure there's still people out there that don't know that we're here. What's unique about our program is that we don't have to have an appointment to come up to the medical center to see us. We have a walk-in policy. You were just in our office around the corner. It's the main VA Medical Center, Building 101, Room 107. You don't have to have an appointment. We offer extended hours. So we know these folks when they come back from service, especially active guard and reserves, they come back to jobs. They come back to school. So we have after hours where we're open till 6 o'clock in the evenings where people can come by and get help and information about VA services and VA benefits.
And those that are interested in these services and programs, is there a number they can contact you or somebody in your staff to get a hold of you? And how would they do it, and where would they go?
So our main program phone number is 503-220-8262, and that extension is 53. 888-888-062. And again, that's the main program extension. And we will link that person to a case manager who can assist them.
Okay, and again, that's up here at the Portland VA Hospital on the hill.
That's our main program location, where it's walk-in clinic for case management. But we provide support at 7 different clinic locations. So we have these post-deployment health clinics, these clinics for returning combat veterans, where they have a primary care provider, a combat stress specialist, and a case manager all on the same visit. And those locations are in Salem, West Lynn, Bend, Hillsborough, Vancouver, East Portland, and the Portland Center for Women's Health. Was that 7?
That's 7.
Okay.
And are we on those programs?
Yeah.
Are those walk-in also at the clinics?
Those are scheduled clinics. So that's, you're going to your post-deployment healthcare team. So again, those are scheduled, but we'll help you schedule those clinics.
And get through those programs.
Absolutely.
Now, you and I were talking earlier about a program that's coming up in Bend next week. And you're going to be there, I believe.
Right.
And I believe it's a 30-60 program. Could you talk a little bit about your function in those?
You bet. We attend all of the Yellow Ribbon events. And the Yellow Ribbon events are sometimes prior to deployment, sometimes during your deployment for the families. And then when they return, there's an event 30 days, 60 days, and 90 days after your return. So those are the Yellow Ribbon events. And there's one coming up in Bend, and we'll be there. We help with enrollment to VA healthcare. We help with any other resources or concerns they may have. Sometimes people come with questions about their claim, what the status is, maybe questions about appointments. We have kind of a back door into the claim office. So we have an identified person that can help work with us and our veterans to help kind of move that along too.
Very good. In the programs that you do, and which is becoming a issue out there, is one of the programs that I understand and I work with very well because I'm part of it, is I'm a veteran with PTSD, and a lot of veterans with post-traumatic stress disorder seem to fall through the cracks because of the PTSD and not getting the help in the very beginning that they need. How can you encourage these veterans through your program to get involved in some of the counseling and programs that you have here?
I think you bring up a good point, and like we were talking about on the break, our program is about early intervention and prevention. We know when people go off to war and they come back, it changes them for the good and the bad. Reintegration is part of that process. So we want to provide that education and that support prior to becoming a diagnosis of PTSD. That's our support. Now, if it becomes where someone is struggling and with post-traumatic stress disorder, then we have services and programs that we can link to that. But again, our goal is different now. We want to intervene prior to that happening. And some of it, we can't, here at the VA, we can't control what happened in the war zone, but we can control how we respond to it and what support we can give when folks come home, how we can arm the families while they're gone, and how we can support the families when they're home too.
Absolutely. I was sitting here reading a post-deployment drop-in group program. And could you tell them a little bit about that and what's going on?
Yeah, that's another it's another group that we offer through our program, and they actually meet in this room that we're sitting in on Tuesdays, and it's a really good group of OEF, OIF, OND veterans who comes together on Tuesdays from 4 to 5:30. It's a drop-in group. You don't have to have an appointment to show up. It's a really good group of veterans who kind of comes together around their experiences in Iraq and Afghanistan and what it's like when they've been home, and how can they use each other to kind of support and move with that.
Well, we're here this morning talking with Victoria and the programs that they have for our returning soldiers from Afghanistan and Iraq. And we have some more important information that we want to make sure that gets out there and what goes on. They're very important that we get to our soldiers early. So what we're going to do is we're going to turn it back over to the studio. We're going to take a break here and let our sponsors again have their word. And we thank our sponsors for the support to make sure that we continue to get this information out to all the soldiers, no matter what war they're in. And we're always going to remember our soldiers, whether they're here at home or whether they're overseas somewhere else serving today, because we have many soldiers serving in countries all over the world, not just Afghanistan and Iraq. But today we're focused on the OIF and OEF soldiers. So we want to turn it over to the studio. We'll be back in just a few minutes, and then we will take the show up to the next break and then call her pretty close. It's back to you, radio. Well, good. We're back up here on the hill. We got a little rain up here, a little wind is what I'm being told. I can't see it. I'm in this little room. And again, we're up here talking about programs for our returning veterans, which is under the OIF and OEF veterans programs. Before we go, and I'm going to probably beat this drum many more times, and that is the post-deployment drop-in groups. And these are really important for our people coming home today because it's a place that they could just walk into and start getting help. So she's going to go over it one more time. Victoria, it's all yours. And when you go over this, give us address, phone number, location, and times.
So our program is the OEF, OIF, OND program at the Portland VA Medical Center. We're in Building 101, Room 107. If you come into the main medical center, there's an information booth. You can actually follow signs to our office. And we're open Monday through Friday, 8 a.m. till 6 p.m., no appointment needed. You can walk in and we can help you with enrollment on the spot. And we have a social worker and a nurse who can kind of sit down and talk about what's going on in your life, how long you've been home, how can we support you on the goals that you want to achieve. You can call us if you'd like to give us a heads up and know you're coming in. That's great too. You don't have to, but you can. And that number is 503-220-8262, and our extension is 53062. So that's the main program information. What you're looking at too is our post-deployment drop-in group, and this is on Tuesdays at 4, also in that same location. And it's for veterans who served in Iraq and Afghanistan who want to meet with other veterans who deployed and who are coming home to talk about kind of what that experience is like for them and to support one another. And we have social workers who facilitate that group as well. The other thing we talked about earlier is our group for families, and this is on Thursdays, also in that same location. We encourage people to call us if you want to come to that group. We want to talk to you about kind of what that group's about and what to expect. So again, call us at the main program number at 503-220-8262, extension 53062.
One of the things that excites me about your program, and I get excited every time I hear a program that involves the second veteran, the veteran that isn't talked about very much, and that is the wives and the children, mothers and fathers that are left home. These people need to be recognized. They need to be understood that they have the problems the veteran has because they've had the stress of waiting, the stress of the coming home. The lives have changed. And again, I want you to just a little bit more talk about the family group support and what you have to offer there for them.
Yeah, I think it's important to bring that up, not only in our family group that we offer up here, but in our day-to-day work. When a veteran comes in, a family is very much a piece of of what's going on and how we can support, because they're with them day in and day out, especially when they've returned from deployment. So how can we work with that service member? How can we work with that family member to all wrap our arms around that veteran? And you brought up another good point, because, you know, here at the medical center, over 10% of these Iraq and Afghanistan veterans are actually women. And so their family members are their husbands, are their partners who were at home taking care of the kids. And now mom's back, and how has it changed? So family, you know, means something different, you know, for everyone. We had a really nice event, a welcome home event at the Winterhawks game 2 weeks ago. And we invited folks who've deployed to Iraq and Afghanistan and their families. And we had several participants of families who were currently deployed coming out to this event, and we want to honor them as well. So that's very much a part of what we want to do, and a message that we want to get out. You know, the family serves with the veteran.
Well, one of the things, Kelly up here, that makes this possible for us to have this show, she knows me. I kind of shoot off the hip a little bit, and usually every time I turn around, I give somebody a challenge before my show's over.
Okay.
And my challenge is going to be simple for you.
Oh, is it? Okay, good.
As you know, that I'm part of Vets Helping Vets, which is an organization that gets out here and really wants to help vets, and we work 7 days a week, 24 hours a day. A veteran can call anytime. But you have some wonderful programs, and you just like the one you were talking about with the Seahawks. I would like to get a schedule of those programs for that we can get out to our veterans early,
okay,
so that we can get it on the air, on the radio, on YouTube,
sure,
out there for everybody to watch. Because as we do our programs, such as we're doing here today, with Eagle One TV,
yeah,
and Operation Eagle's Wings.
Yeah.
So these are important to me to get this information out to every veteran any way I can. So my challenge to you is get me the calendars early.
Are you all on Facebook?
I am on Facebook.
Oh, because we do all of our postings on Facebook. So if you're liking VA Portland, you would get those updates through Facebook. But if we want to talk about other ways to communicate that information with you, we can certainly do that too. But that's one way that Kelly Public Affairs here certainly supports us with getting the message out, is through Facebook. And that certainly meets the certainly where you're plugged into, and it certainly meets the needs of our returning combat veterans who are on the internet.
And a little different twist to the radio show is, what can we as a community,
yeah,
and veterans and families do to help you make the program a success?
Well, thanks for asking. I think we talked about this earlier. It takes a team. You know, and we're not the only, you know, VA is not the only piece of that puzzle. You know, it's your group, it's the Veteran Service Officers, it's the Oregon Department of Veterans Affairs, it's the churches, it's the employers, it's the J9, it's all of us together. Keep on talking about this. You know, the war's not over. People are still coming home. People are still in active duty who've deployed, who maybe won't get out for another 15, 20 years. We're going to see these people are our service for life. You know, they've deployed and they've come back, but now they're ours, and we get the opportunity of taking care of them. And when I say they're ours, they're not just me at the VA. They're all of ours, and it brings a tear to my eye to think about it. But it's actually an honor, you know. And how can we keep on talking about it, and how can we keep on working together to do this? Because it's all of our jobs.
And to show how much we appreciate them. I was told one time as a child,
yeah,
that a hero wears a cape.
Oh.
But that's not true. A hero wears dog tags. And that's where our heroes are at. Mm-hmm. And so we need to constantly be remembering that we can help those when they come home.
Yeah.
And through your programs and everything that comes on with what we're doing is very important. Mm-hmm. Again, one more time before we go to our last break, is I want to have you give our phone numbers, addresses, and then we're going to come back and we're going to do a summary over everything we've talked about today and what is out there and going to be happening in the next month for programs.
Okay. So you can call us at 503-220-8262, extension 53062. You can visit us without an appointment at the Portland VA Medical Center, Building 101, Room 107. Or you can like us on Facebook, VA Portland, and we certainly get our information that way too.
Okay, so we're going to go back, take one more break, and then we're going to be back for return, and we're going to just go over these different dates and programs and what it's all about and sum it up. It's back to you. Okay, well, we're back on the air, and we're going to take this next little segment here, and we're just going to go over everything. But one of the areas that I'm going to ask her to really emphasize is we talked about her staff of 10 in her office. There's some nurses and different programs, and just really what is part of the program that can be really effective for our returning veterans.
Well, I think that's important to mention, and there's social workers and nurses who work together to support the returning combat veterans and their families. So when you come to the main office in Portland, we'll help with enrollment, we help with first appointments, and then we can get you scheduled into one of our post-deployment clinics at all of our various sites that I mentioned earlier. We have 7 different sites where we support these clinics. And at these clinics, you'll be assigned, that's your primary care provider. At your first visit, they spend 2 to 3 hours with that veteran and their family, if the family comes with them. We spend up to 2 to 3 hours kind of taking a pretty detailed military history, a pretty detailed assessment of kind of where they've been and where they want to go. So they spend about an hour with the primary care doctor that's trained up in the unique needs of combat vets. They spend some time with a combat stress specialist or a mental health psychologist. So this goes to the piece where you were asking about PTSD. We talk about that stuff before it's even identified. Even if the veteran says, hey, I'm fine, we want to say that's great that you're fine, and I want you to be fine, but if things happen, we want you to know where you can come to support. So we ask about the mental health piece up front. And then the other piece of that clinic is a case manager, and those are the same case managers that are here in the Portland office. It's either a social worker or a nurse who talks about how things are going at home, how are things going with you in your work, how is housing. Sometimes we get people who are homeless. We help them with housing. How are your VA benefits going? We can support with that. So it's really a holistic look at that veteran within their family, within their community. And that all comes together at our post-deployment clinics and in our office.
Okay, now on the next part of your program is I'm going to ask you one more time to give us the phone numbers, the addresses, and where they can get to today.
You bet. So, again, we're at the Portland VA Medical Center in Building 101, Room 107. If you make it to the Portland VA Medical Center, you can simply ask the information booth or follow signs to our office, the OEF, OIF, OND program office. No appointment needed to show up at that office. Or you can call us, 503-220-8262, extension 53062. You can also follow VA Portland on Facebook. We often post information about our services, our events, as well as our groups there.
Very good. Today's show was brought to you for the purposes of getting information out to our returning veterans coming home from Iraq and Afghanistan. We always want to remember that we have veterans serving all over the world, and they're out there continually marching at time to make sure that the Constitution of this country is upheld and that we always hold the freedoms that gives us. So we want to honor our soldiers. We want to thank them for the service that they've had. We also want to remind the people that not only here at KGAL radio station, 1580 AM, but you can also go on Operation Eagle's Wings on your computer and pull up or on your Facebook and watch these radio shows and other programs that we have for veterans. You can go to operationeaglewings.us and you can find it. These are very important. Also, there will be information in the future on upcoming events through the OIF and OEF program. So remember, our homecoming veterans are very special to us and what goes on. Again, I've always told everybody at the end of the show that part of Vets Helping Vets is an organization that's out there to help veterans get to these programs or help you get signed up for your benefits, whether it be disability or medical, get you into the counseling and the programs that are coming up. So you can contact Vets Helping Vets or myself at 541-905-7237, or you can email me at Victor Kuhns, Kuhns, at yahoo.com. And again, that's Victor, Victor, Kuhns, Kuhns, at yahoo.com. And anything you want to ask, go ahead and ask, because we will. If we don't have the answers, we'll find the answers. If we don't have the people available, we'll find the people. We're there to not only give you the information, but we're also there to advocate for you when you need it. So give us a call. We're always there. Again, our focus today was on our returning soldiers. There's programs that are coming up. This is on every Tuesday, the post-deployment drop-in groups. We encourage our young veterans and men and women coming home to come into these groups. It starts at 4 p.m., goes to 5:30. There's no appointment necessary. And any questions, you can call up here again at 503-220-8262 and extension 57049. And they'll give you the information on the programs. They're very good programs. It gives you a chance to talk to somebody, talk to each other, and be able to go on with what we have always fought for, and that's a good quality life. We don't have to carry these burdens around anymore like we've done in past wars. Programs are now available. So always remember, as a veteran out there and a veteran's family, you're not alone. We're here to support you. So again, this is Victor Kuhns with Vet Talk. And Victoria, I want to thank you for coming and being here to share the programs that we have. And we're going to turn it back to the radio station, and we will see you the second Wednesday of next month. And we will be doing a show with Vets Crossing out of Albany, Oregon, and the programs coming up there. So have a good month and a good week, and we will see you soon.